It's currently using the combined contraceptive pill to manage perimenopause symptoms. Her doctor has said she needs to move, though, to HRT soon. She's 49. Is there a good reason to have the change? The combined contraceptive pill's really working well. She's reluctant to change unless absolutely necessary. Also does need contraception, but a bit confused as to how she would manage this if she switches to HRT. What?
Yeah. So I get that, and if it ain't broke, don't fix it, and I totally understand that. The reason your GP is giving that advice is that the guidance is at 50. The kind of negatives of the combined pill probably outweigh the benefits. Um, because as we get older, our risk of clots goes up, and oral estrogen increases that risk further. It depends a little bit. Well, I mean, that's the guidance from the FSRH. That's the guidelines. Um, it's it depends a little bit on what else is going on. So if you don't smoke, if you're not overweight, if you don't have a family history of clot, or you don't have clots yourself, you don't have a history of migraine with aura, then you can maybe eke it out a little bit longer. And if it's suiting you so well, then that's a discussion to have with your GP, because obviously as a prescriber, you take on that responsibility. But at the end of the day, it's your health, and so you have that informed decision, and you have an informed conversation, and make an informed decision that's right for you. Um, the preference is at 50, so you've got a bit of time, is to move towards an estrogen free contraceptive. So that can be the Mirena, it can be the progesterone only pill, it can be condoms, it can be the copper coil. And then you don't have the estrogen increased risk of clot, which if you don't have any other risk factors is still low, but it goes up with age. So it's important to factor in. And in which case then you could look at switching to some HRT, and you can use the Mirena, which is licensed for contraception and for progesterone component of HRT for endometrial protection, with estrogen, which is normally the body identical transdermal, so spray, patch, or gel. Or you could use off license, the mini pill, and take three of them. And so then you've got the contraception. It's off license, but it's okay. The British Menopause Society guidelines have it there that you can consider using that alongside a estrogen HRT. So you're getting the contraception and you're getting the endometrial protection off license, and then you're getting the benefits of the estrogen through the skin. And when you have estrogen through the skin, there's no increased risk of clot.
Goodness, you're earning your tea
Did,
tonight.
did
Yeah,
that make sense?
absolutely it did. But
Good.
again, this lady's really left thinking there's no other choices.
There's
Um,
loads of choices, and the guidance. So you can look online at the FSRH, so the Faculty of Sexual and Reproductive Health guidelines. They're there, and up to 50. That it's 50 when they say that it's probably better that you don't, because the risks kind of are felt to outweigh the benefits at that point. But
yeah.
it depends on your overall health and well-being, and there's lots of other
Mm,
factors, and it's a conversation to have,
yeah.
because they're the guidelines, but you are an individual person, and so
Mm.
you take a view, have as much knowledge as you can, and have that discussion. But it's between you and whoever's prescribing the pill.